I'm Janie Rhyne. I'm an art therapist.
Nice to meet you. My name's Brittany.
Hi, Brittany. Oh, it's nice to meet you. I utilize Gestalt art therapy, which means three things. First, I like to focus on you, the client. I think you're the most important person here, so it's important to pay attention to what you have to say and what you're feeling. Okay? Great, great. Secondly, I like to stay present, or in the here and now. So while we will talk about things that happen in your daily lives, I think it's important to stay sort of in the moment.
Okay.
Does that make sense?
Yeah.
Good, good. Now this means that periodically I'll be checking in on you, seeing how you're feeling and sort of going over your experiences right now. Okay?
Yeah.
Great, great. So then the third thing is I'm interested in you in your entirety. I think that people are more than just the sum of their parts, and it's difficult to tackle any problem when it's in isolation. And that's why I like to approach treatment holistically. Okay?
Great, thanks.
Now, can you tell me a little bit about why you're here?
Yeah, so I've always been a little anxious, even as a wee tot. And then I thought it was pretty much under control until about 4 or 5 months ago when all of a sudden I called in sick to work 2 or 3 times because I was supposed to have this presentation to do, and I couldn't even get out of bed. I was so paralyzed with this thought of doing this. My friends started to kind of get on me because I'll make plans with them, you know, a week in advance saying, yeah, I'll be there. And then the night of, or like 20 minutes before I'm supposed to be there, I call and say, I can't do it. And it's a little frustrating. And then again, sometimes at work, I get so overwhelmed just with everything. I have to go to the bathroom and just kind of decompress and just kind of hole up and just be alone for a little while. So it's starting to interfere.
It's starting to interfere. Can you tell me what it feels like when you get very overwhelmed, you said?
Yeah. So I feel it up in here, and it's like a weight. It's really heavy, and it gets hard to breathe. And then I feel really like busy in this area too.
Okay. Can you tell me how you're feeling right now?
It's a little hard to breathe, and but I'm not as busy. It doesn't feel as overwhelming as like when it gets really bad.
Great. Well, thank you for sharing that. Because we have only a limited amount of time, I'd like to jump right into an art activity. Is that
Let's
okay?
do it. Yep.
Great. If you could take a piece of paper and choose one of the art mediums.
Great. Yeah.
I'm going to have you do a scribble drawing.
Okay.
You can draw figures or shapes. I pretty much want you to just doodle whatever comes naturally to you.
Okay.
And as you're doing this, I want you to focus on your breathing. I want you to really pay attention to what your body's telling you. I want you to notice your motions and the rhythm of your movements. Very good. This sort of bodily awareness is important because it leads to self-awareness. And when you have self-awareness, it's easier to see inside what you're thinking and what you're really feeling. This insight will help you sort of identify these maladaptive behaviors that you had and might move us toward more healthy functioning. Okay?
All right.
You done?
Yes.
Good. Now can you tell me what that experience was like for you?
Not bad. It was easier than sitting here gabbing about how I'm feeling.
Good. Great. Is it okay if we take a look at what you
Definitely.
did?
Yep.
Okay. Now, like I said earlier, I'm interested in sort of your interpretation of the picture. I want you to look at this, again, using the whole image, and maybe tell me what it means.
Okay.
Looking at the relationships of the shapes and the designs.
Oh, this is easy. Sure.
Okay.
This is how I was feeling when we first started. Like I said, I was having problems breathing, but it wasn't super crazy. Yeah, so I was kind of all up in there. And then you were talking, you recommended breathing, and that was genius. So things got a little bit easier and more spaced out with the breathing. It was kind of like I was moving the pencil or charcoal pencil with my breath. So it was really nice and calming. So that's pretty much where I ended up in here. And at the end, I was just kind of having fun and kind of Picasso-esque.
Great. I think that's wonderful. You've made wonderful progress for the day. Unfortunately, we are out of time, but I look forward to seeing you next week.
Great. Thank you so much.
You're very welcome.